Okay, I'm going to go ahead and get started here. I think we've got most of our registered attendees. Good afternoon and welcome to today's Lauterbach-Naiman webinar, FEMA, What You Need to Know Related to COVID-19 and the Application Process. The presentation today will be focused on FEMA's public assistance programs specific to the COVID-19 pandemic. My name is Tim Gavin. I'll be one of the panelists today. I'm an audit and financial services manager. I've been serving the public sector in that role for coming up on about 15 years. I'm joined today by Tanya Walker, who has an extensive background in accounting and financial management in both public and private sectors. Navigating this funding opportunity has been a big source of confusion for many of us. So our goal today is to help make sense of it all. We'll show you how to get the process started, which forms to complete and submit, identify what costs may be eligible for reimbursement, and which documentation you'll be expected to maintain and accumulate. One important disclaimer I should make today is that portions of this process are brand new. None of us have seen it all the way through, and things are developing almost daily. So really your best source of authoritative information right now is the Illinois Emergency Management Agency. We will monitor for questions throughout the presentation using the Zoom Q&A feature, and we'll hopefully also have time for questions at the end. Without further delay, I'm going to pass it off to Tanya to get things kicked off for us. All right, Tanya, we can't hear you. She may be having some technical difficulties, so let's get that sorted out real quick.
There you go. I was on mute. I apologize about that. Hi, guys.
Right. Thanks, Tanya.
Yep. Sorry about that. My name is Tanya, as Tim had mentioned. We kind of just want to give you a brief overview of how do we start, how do we get the application process even going. As a lot of you know, there is a lot of information that's kind of been thrown at us with webinars and different things where you might be a little confused as to where you do begin. So with that being said, on our first one, it's kind of where do you start? Where do I go with it? And as you see, I have on there the deadline as May 15th, but that is not true. As he had mentioned, everything is changing rapidly and so quickly that they have no longer have a date on that. They have waived the deadline. So right now there is no official deadline for this grant to be completed and the application to go through. In the past, they were going with paper type applications. They have now streamlined that, and a whole new feature of FEMA is a quick way to apply online through the portal, and this is the website address, as you'll see on top. That's where you're going to go to basically do all of your portal applications. That you're going to do your RPA application, your organization application. So pretty much this is going to be your one-stop shop when it comes to getting through onto the application process. Once you log on, you will see a yellow, and it's also highlighted in red. This is how you're going to register, just like you would have done in the past with the paper. This is the new way of registering with the online application. You're going to want to hit that plus button and go in there and directly apply for everything. When you do go in there, just as a side note, you will need your DUNS number and your federal identification number when you do log on. Once you get in there, you will see that you're basically going to fill out all of your basic information. Your state, territory, organization, you're going to use your drop-down and select that. The only drop-down you will be able to use for the emergency disaster is only going to show your COVID-19 code. So you can't pick anything incorrectly. You will only pick the COVID-19 code. And as you go along through the steps, it's pretty self-explanatory when you get into the information they request, just to even get into the online portion of the application. And then once you get through just the online application, you're going to receive an email that's going to tell you that your online application has been approved. Once you do receive that email, you're going to click on it, right back to the link that's going to bring you right back to the beginning link that I had mentioned. And it's going to give you a username, and it's going to give you a password. Those are what you're going to want to re-log into to go into the next step, which is basically going to get you to set up your whole dashboard and your whole portal. Here you're going to enter all your organizational information, your personnel, your profile. All kinds of information here is going to be where you're going to put anything related to just your setup of the people that will be in control of the grant. We do have a very large PDF grant portal application user manual that we'll be happy to share with anybody upon request. And again, once you set that up, you will receive another email telling you your setup. So through the whole process, you're going to be confirmed, and they're going to tell you that you're set up, for certain and different things at different times. So you know you're going through the right flow and the right process of doing what you're supposed to be doing. And once you get to this point, it's pretty much where you're going to start then after you get the approvals is to then start to get your additional forms ready and to get going with that. With that being said, for the simple process of the application, after you get through those pieces is when you're going to go through the agreements and everything that Tim's going to walk everybody through as far as the forms and what's going to be eligible expenses and ineligible expenses as well.
Tim and Tanya, this is Jamie Wilkie. I just wanted to interrupt. We have a number of questions that have come in, and I think this is maybe a good stopping point to address a few of them, if that works for you both.
Sure.
Absolutely. I do see some of them coming through, so
yes.
Tanya, if you don't mind, I'll jump in on the ones I know. The first question I see: do you have to register with both FEMA and IEMA? It's the same application, so what you used to do, which you would have done if you did it before April 15th, is you submit the it's a FEMA form 90-49. You could have either sent it through IEMA or directly to FEMA, but either way it's the same form. The online version, again, it's the same thing. So if you are submitting it through FEMA, through the electronic through the portal, it does go to IEMA as well. So you don't need to submit anything separately at the initial stage.
Correct.
I think that answers at least two of the questions. I see another question is the manual from FEMA. Tanya, I think you were referring to that from FEMA.
Yes, it is directly from FEMA on one of the webinars that I had attended in the past. And it is a manual. It is a manual that will detail screenshots and it will take you through step by step of the things that you get deeper into as far as what the personnel part of it you might put into your grant portal, your organization information. It's going to give you the details you'll need to put in there.
And Tanya, is that something we can provide? One of the earlier questions I received was getting a copy of the presentation, and obviously we'll be submitting that as follow-up after today's presentation. But is that a link to a web address we could provide as part of that follow-up to all of our registrations today?
I don't believe it's a link. It is a PDF file. It is a large PDF file, but I can look into that to see if I can find a link directly to it, but I don't believe there is, but I will double check that.
Okay, thank you.
Once you do get, and I don't know if I may be getting ahead a little bit here, but once you get into the FEMA grant portal, there is an extensive resources section where it's pretty comprehensive. I believe all the portal usage manuals and any other public assistance guidance is there. In addition to that, on the IEMA website, there is public assistance forms section that not only includes the forms that we're going to talk about in just a minute, but also they have their public assistance program application handbook. So that, again, is a wealth of information, probably more than you really need, but most of the questions can be answered in one of those two places. So we'll include links to all these documents when we share the slides at the end. At this point, we'll kind of walk through, once you have submitted your initial application for public assistance and have gotten approval and been granted access to the FEMA portal, there's a few additional things to do. So once you've been given access, on the FEMA side, there's what they're calling a simplified application for expenses. Up until about a week ago, that was a PDF form. It's now actually part of the portal, so we'll go over that. And then there's 3 forms that need to get submitted separately to IEMA, and I think this is where some other confusion has been coming from. There's a grant agreement, an FFATA certification, and a risk assessment that doesn't go to FEMA, but rather IEMA separately. So we'll talk about those forms as well. So for the FEMA project application, once you've been given access to the portal, this is a screenshot from the portal that you're seeing on the screen right now. Over here, you have all of the actions you can take, and within the My Organization section, there's an applicant event profiles that will list the approved grant programs. So once you've submitted your request for public assistance and it's been approved, it will show up here. So you'll see 4489DR-IL. That's the code for the COVID-19 event. You can go into that, and then once you are viewing that grant, you have a link to submit a product application. For those of you who may have already seen the FEMA simplified application for expenses, this is basically the online version of that. So clicking that will bring you to a series of subsequent screens that let you fill in all of the information that they're looking for to submit a project for reimbursement. On the very first page, you see some important information, which I'll go through and kind of point out the key items. So a couple of key things on this first screen here. Obviously, it should go without saying, if you fill out something wrong or incomplete, it's going to delay the process because they review these pretty thoroughly. So if there's any corrections, they'll kick it back to you and you'll have to make the corrections and resubmit. Obviously, that'll set back any funding disbursements. FEMA will only fund 75% of the total activity cost. So if you've added up everything you believe is eligible and you've got $50,000 of expenditures, FEMA is going to only cover 75% of that. If you've got other grant funding opportunities, you can't overlap, so no double dipping on grants. Also, no duplication of medical payments, and if you've got any insurance coverage for anything that may have happened as a result of COVID, obviously you don't want to overlap that either. Throughout the application and the instructions, they refer to a couple of terms that I think is important to clarify. So they refer to the terms applicant, recipient, and project/subgrant. When they talk about applicant, that's you. You're the ultimate end user. You're the one incurring the costs and applying for reimbursement. Recipient is actually the state of Illinois through the IEMA. So whenever they refer to recipient, that's not you, that's actually state agency through which all the funds flow. Project and subgrant, once you submit this project application, it effectively becomes a subgrant of what was given to the state. So it's a grant to you, a subgrant of the overall amount that went to the state of Illinois. And that's what those terms mean. So what information are you going to need to have available in order to go through the project application process? Obviously, you'll have to know what activities were done, when and where and by whom they were completed or will be completed. You'll need, and I recommend this anyway, and we'll talk about this when we go over documentation, but an itemized summary of which activities were done and what those cost. So you're not just, you're not just going through a pile of detailed documents. So anything relevant to not only personnel costs, but also contractual services that were performed, any equipment or supplies that were purchased, any materials used, and anything to support any other costs. And have your documentation ready. Once you're ready to submit the project application, you want to make sure you've already got your ducks in a row, so you're not scrambling, you're not setting the application aside and coming back to it. FEMA recommends that, if possible, you should only submit one project application. That makes it much easier for them to process. I actually spoke with a gentleman from IEMA earlier today. He had casually mentioned that he's been processing about 1,200 applications right now for COVID assistance, and I can imagine that's a pretty big job. So the more applications you submit, the more administrative time is going to be spent on those, and again, it may further delay your funding. If you do have an immediate funding need, then you do have the option to actually submit for either expedited funding, or you can submit an initial project application, and then you can do an initial application for follow-up for additional activities. So what happens after? Again, this is some helpful stuff on the first screen before you even get to the application. Point number one there, and this is why I pointed out the definition of recipient. The FEMA and the recipient will review the project application and validate the information and documentation provided. Again, recipient is the state of Illinois. So final say on whether your costs will be reimbursed falls on both the federal level and the state level. Once they complete that review and everything is in order and they've followed up with you for any additional information they need, they will let you know that the application is ready to be awarded, and then they'll send you some terms and documents to sign and agree to. And then once the subgrant is agreed to, FEMA will make funding available to the recipient. Again, recipient is the state, for disbursement to you. Point 5 there is important. Again, it's ultimately your responsibility to monitor yourself for compliance and report to them. They're going to require certain things, certain documentation, and the responsibility is on you. And then, of course, if you any subsequent, if you have a single audit requirement during your annual audit, you may need to ensure compliance with that as well. So beyond the FEMA project application form, there's a few IEMA grant forms that you will need to complete. 3 of them in particular. The first one is Form PA 101, and that is a sort of a generic grant agreement for their public assistance program. I've kind of highlighted just the basics, fields that you'll need to fill in. The federal declaration number To my knowledge, that is the same number that I pointed out earlier on the FEMA portal. So the declaration number is 4489DR, and then a -IL identifies it as Illinois. Basic information for your organization name, address, city, state, etc. And then very important, and you'll need this in order to fill out the initial public assistance application, but you need your FEIN, you'll need your DUNS number, and you'll need to make sure you have a current registration on sam.gov. If you don't have any of those in place, I recommend, because it's a bit of a process, make sure that you have the DUNS number and the SAM registration done before you start this process, or else again you'll kind of be scrambling to find the info. So make sure you look into that. Further down the same form, you need to identify an agent for your organization. So it may be whoever your chief executive is, it may be your finance director, whoever should be the main point of contact for your organization. So name, title, organization name, street address, etc. Identify what type of applicant you are. This should give you a sense of what organizations are eligible to apply for assistance. There's also a series of grant conditions. I haven't captured all of them because a lot of them are very boilerplate and pretty expected. Just wanted to point out just a couple of them here. Number 3, it says you're certifying that you're not applying for disaster assistance for which is receiving duplicate benefits for the same loss. In other words, you are not getting grant money to cover the exact same costs that you'll be asking FEMA to reimburse you for. Also, number 10, this is a standard line for all IEMA public assistance grants, and that is an agreement that you'll submit quarterly progress reports by the 15th of the first month of every quarter. This says for all grants in excess of $25,000, the threshold is either that $25,000 or a $131,000 large project threshold that FEMA has set. When I spoke with a gentleman from IEMA today, he mentioned the $131,000 threshold. If you're unsure, because I don't know officially that that's the guidance, I would be prepared to submit quarterly progress reports. The next one obviously would be coming up in July. But if you are between $25,000 and $131,000, I would double check with IEMA to see if they are indeed asking for that. I have not heard except for the one gentleman I spoke to today. And then the bottom of Form PA 101, just the signature and name, title, date, etc. So that completes the generic grant agreement form that'll have to go to IEMA separately. An additional form that should be easy for most, if not all of you, is Form PA 109, and that is the FFATA certification. I don't remember what FFATA stands for, but if your organization receives, if 80% or more of your gross annual revenue is federal funds, and you spend, and your annual gross revenues federal funds are $25 million or more, then you have to provide compensation amounts for your top 5 executives. I haven't yet encountered anyone that needs to do this, but it is a form you have to fill out either way. Finally, IEMA has a risk assessment form. The purpose of this form is for them to assess how much monitoring to apply to your organization. It is in your best interest to be as honest as you can be, because they'll be able to verify most of this information anyway. So if you've had previous public assistance experience with IEMA, you can identify that in question 1. Obviously, that if you did have that assistance and it went well, that lowers your risk from their standpoint. Number 2, if you've had single audits of federal funds during the last 10 years, you can report whether you had any significant findings, what the extent of those findings were. If you're unsure, I would Google Federal Audit Clearinghouse, and the single audit information is publicly available. There's an option to search. You can search for your own organization and look through the last 10 years. If you've had a single audit requirement, you can pull those up and see if you had any findings. Further down that form, whether you've had any significant changes to your personnel or systems specifically related to grant management, and whether you have had any monitoring or site visits related to any grants, and whether those site visits or monitoring had any findings. Again, all of this is to make sure that they're not taking a big risk sending you money. So all 3 of those forms, at least the last guidance that I received, need to be signed on paper and mailed to this address. So again, we'll share the slides after the presentation. You'll have this address handy, but that's where all 3 of those forms go, just the IEMA ones. So now the big topic, and the topic that I anticipate will probably get the most questions, and based on my experience so far, may have the most disappointments. So, get the easy stuff out of the way. Eligible costs must have occurred in the period beginning January 20th and December 31st, 2020. I can't say for sure whether that ending date is movable depending on how long this whole experience, how long we have to deal with it. But it does go back to January 20th, which you may note is prior to the presidential declaration, but that is baked into the project application form. So the department, this is, I think, a very important point to make because it sets the tone for what's to follow. The interpretation of the term necessary really means expenditures reasonably necessary for their intended use in the reasonable judgment of government officials responsible for spending fund payments. And I think it's also important to note FEMA is a emergency management agency focused on the physical health of the public and, in the case of other disasters, public structures and things like that, not necessarily the economic health of your local jurisdiction. We'll go through this in more detail when we go through the list of eligible costs, but I get a lot of questions on whether or not your mayor deciding to make stimulus payments to local restaurants that had to shut down, whether that constitutes an eligible cost under FEMA public assistance. And I can safely say that it does not. And I think that's where a lot of the disappointments are coming from. Again, the focus is on protecting the health of the public and making sure that any response is specifically related to that. So all of the costs that follow should be read with that in mind. So if you ask generically, hey, what costs are eligible for reimbursement, you will be directed to the IEMA Public Assistance Applicant Handbook. That handbook is available on the IEMA website, and we'll provide a link, but there's a very large list of categories of expenses that apply to any and all IEMA events. Specific to the COVID-19 event, the applicable expenses are Category B, Emergency Protective Measures, and that you have your hands on that handbook. That's starting on page 14. So the costs that I have listed out in the following slides are directly off of the FEMA Streamlined Project application. So specific costs, because the list is fairly generic, specific costs will be subject to approval by FEMA and IEMA. So where the listing has a catch-all at the end of each subcategory called Other, you'll be expected to justify why you are requesting reimbursement for that and how it relates specifically to emergency protective measures. The biggest issue we have right now is we don't have any test cases. We don't have anyone that has gone all the way through the process, at least to my knowledge, and has received reimbursement. So we are kind of, pioneering this right now. But again, I think with all the guidance we have so far, we're starting to paint a clearer picture of what you'll be able to receive. And again, bottom line, no double dipping. If you have other grants that are applying to the cost you're incurring, don't also request reimbursement from FEMA. So here's the list. And I've highlighted, well, this is slide one of several slides. I've highlighted a few of the items that I think will relate specifically to, many of you. I think if you were a healthcare organization, you may have more of these costs. There are a lot of things that run at the state level or county level that may be applying that won't necessarily apply to the local level. So again, read through the entire list, but I think the highlighted ones are most eligible. So training, facility disinfection, I think that's probably occurring a lot. To what extent, how material is the money that you're spending. You'll want to make sure it's costs that you're incurring beyond your normal day-to-day business. Communication, so dissemination of info to the public, that may involve contracted services for putting together communication, actually issuing communications. Security, law enforcement, barricading, and patrolling, that is not to be taken generically, meaning just because your cops are out patrolling the neighborhoods like they normally would be, that's not a cost that qualifies. Rather, it's law enforcement, security, etc., specifically related to a COVID-19 necessity. The largest thing, I think the category subject to the greatest amount of expense is going to be in emergency medical care. And I think, again, this is an area that many municipalities aren't necessarily going to be incurring these costs. But if you are purchasing, masks or gloves or coveralls or any personal protective equipment, you can likely include those costs in a project application. If you happen to be running any testing centers or providing emergency medical transport specific to COVID-19 patients, those would likely qualify. Again, I happen to know there's a number of testing sites now set up in the state. They are state run. So just, if you're incurring costs, if you're running a testing center, by all means. Otherwise, it may be another jurisdiction that is operating those testing centers. Just mentioned community-based testing sites. Again, if you happen to be operating a testing site, that would qualify. I've not yet become aware of any local jurisdictions that are operating those sites. If you are providing any sheltering or temporary lodging for necessary isolation or quarantine, or sheltering high-risk populations, if you are a community with a homeless population, that may apply to you. So I would look into that if you're incurring, again, additional extra costs specifically related to COVID-19 and protecting the public health. And here's the catch-all. Other activity, I would say use that at your own risk. If you're unsure, IEMA seems to be ready and able to tell you right away if a cost is eligible for reimbursement. So what is definitely not eligible? Now this is another item of disappointment for many of you. Non-overtime emergency work performed by budgeted employees. In other words, if you have a roster of police officers that you budgeted their time for, they are full-time people, and they've reallocated some of their time to a COVID-19 response, but they are not working overtime because of it, that time is not eligible for reimbursement. So you may be spending time on these activities, but if it's not overtime above and beyond for a budgeted employee, then it's not eligible. If you do have employees that are not budgeted, they are eligible for straight time. So if someone has joined your team specific to assist with the COVID-19 response, their time would be eligible to be reimbursed entirely. However, if any budgeted employees, it's just overtime. Local economic stimulus payments. I did ask IEMA this specifically. If you are sending checks out to your local retail stores or restaurants to help them weather the storm, that's on your dime unless there are other grant opportunities that would cover them. Credit for lost revenues or delinquent utility billing payments, etc. There is no provision in FEMA public assistance for those. I know a lot of folks are unemployed and not, falling behind on their water payments, or a lot of, especially park districts and special recreation districts and other similar organizations have had to cancel programs. Sales taxes are not coming in. None of these are disaster mitigation costs. They're unfortunate side effects, but they don't qualify for reimbursement. Other things that are not directly related to protecting the public health. Another item that I did ask IEMA specifically was, I know a number of you, probably most of you, have sent many of your employees home to work, and you may have had to purchase equipment, laptops, networking devices, in order to allow them to work from home. Those costs are not reimbursable either. So bottom line, except for the things that I've overtly confirmed with IEMA, the judgment of eligibility is our opinion until there's further clarification from FEMA and IEMA. So in other words, if I say something is likely to be eligible, proceed at your own risk, unless you want to check specifically with IEMA on that. So they seem more than willing to address those questions. All right. Required documentation. I'll go straight to the third bullet point. I think you should be prepared with everything that you could possibly need to support your costs. IEMA does have a documentation checklist that is very helpful. So each type of cost, whether it's contracts or your own force account labor, equipment purchases, equipment rentals, any type of cost, they list out what documentation you're expected to maintain. Another item worth pointing out, I mentioned earlier that on the FEMA project application, there is a threshold that determines whether you are a big project or a small project, and that threshold is $131,100. A nice round number. So depending on whether you fall above or below that threshold will determine which of their forms you need to fill out and which documentation you need to submit with those forms. That being said, just because you will likely have a small project under that threshold doesn't mean you don't need to maintain the documentation. At any point, IEMA reserves the right to request support for your costs, and auditors may want to verify that you've been truthful on the application, or any number of folks could request support for what you've submitted. So I say be prepared with everything, keep everything set aside, keep copies of everything, because you never know. So what do I suggest you keep? And and this is all in line with what IEMA is recommending. Keep a summary of costs. Again, if you keep a running list and totals, it allows you to kind of double check where you're at in terms of total costs. If you are spending a lot of things and you think you may be at that large project threshold, a summary is going to help you assess that. Anything involving contractual services or purchase of equipment or other supplies, keep those invoices handy. If you are doing any contracts, you're going to want to make sure you have the contract maintained, as well as if it's large enough contract that you need to do any competitive bidding, that you have all of the bid documents and all of the support that you need to have to support that process. Or any payroll costs, and this is the force account labor expenses. The timesheets should demonstrate that the activity being expensed to this were COVID-19 related. I'm thinking in particular, first responder folks, public safety people, anyone, and even if you don't have, if you've got full timers who don't complete timesheets, I'd recommend if they are spending time that you think might be reimbursable, have them, even if you have to come up with a form, have them document what they did with their time and how much time it took. Again, and this would really only fall under the overtime for budgeted employees. One step further, have the payroll registers that are related to those payrolls. So have those handy. And then there are two forms. I'm not going to go through them in detail. It's a little beyond the scope of this right now, but FEMA has two forms that will need to be completed and submitted for force account labor. There's a summary record, which basically asks you to list out the employees who you're requesting reimbursement for, what their activities were, the time, the wages, etc. And then a separate form called the Applicant's Benefits Calculation Worksheet. And effectively, that allows you to take your benefit costs to them and include that. So it calculates what the benefits were to those employees who are on that list, and apply that additional benefit cost to your reimbursement request. Other suggested documentation. Again, FEMA has forms for everything. So if you have purchased or used materials, and that could be materials you already had on hand, if you've rented equipment, that one in particular can be tricky. There are standard rates at which you can charge to grants for specific equipment. Because it gets fairly complicated, FEMA does allow you to check a box in the application process where they will calculate it for you. You just give them some of the info and they will basically determine your rate. If you ask me, that's the safest way to do it. Cuts down on a little bit of your admin time, as well as ensures that as long as you fed them the right info, you're going to get the correct rate and it shouldn't come back to you for revision. Again, contract work, there's some forms related to contracting. FEMA actually does have either FEMA or IEMA, but there's a procurement webinar. I'm fairly certain it's FEMA. A procurement webinar where they specifically talk about the contracting process for eligible costs. So I recommend looking into that if you're going to be contracting any. Again, I mentioned earlier, if you have any competitive bids, if you are contracting for any particular larger costs, have those the competitive bidding documents handy. There's a lower standard of documentation submission for those small project under the threshold. Again, I should emphasize the word submission. Just because the application is not asking for every document under the sun doesn't mean you don't need to maintain and have ready every document under the sun. So you should still maintain comprehensive records of everything that you are accumulating as an expense. We've allocated an hour today, and I am wrapping up the prepared content, and I know we have a number of questions coming through, so I know we have time to answer some. So I'm gonna turn it over to the question process.
Thanks, Tim. Yeah, most of these I think related to expenses, so was just kind of holding off until you got through that discussion. So let me just run through. It looks like we've got about 11 questions here we should be able to get through. So question 1, CARES Act stimulus money sent to organizations is the definition of, quote, medical payments, correct? So you alluded to not being able to get reimbursed for, quote, medical payments. So wondering if you could just expand on that.
Yes, I'll also open up Tanya to possibly answering that if you have better info than I do. I'm not a CARES Act expert.
I'm not as well, but if it's related to the municipality and you're discussing the medical payments or any stimulus type payments, I'm going to go with what Tim had mentioned earlier, as far as that stimulus money not being reimbursable.
Right, I think this goes back to the no double dipping concept.
Yeah.
Being reimbursed for COVID-related expenses from any other organization, in theory, you would not qualify under FEMA for additional reimbursement for the same expenses.
Yep,
I would agree.
Yeah, I think that's the correct conclusion. And you know, I don't want to be the bearer of bad news, but I think a lot of us are going to find out we aren't entitled to as much as we were hoping. This process, I think, is still necessary because everyone's incurring costs, but I think for the most part, it's going to be lower than we think. But yeah, I would agree that any additional funds coming through need to be deducted from what we spent.
Second question, you mentioned the progress report. Is there a format for that? I think you were alluding to the quarterly report filings that may be necessary. Is that all provided through the web portal and those forms that you referenced earlier, Tim?
Yeah, there is. I believe there's a standard form for the progress report, and it was, yeah, actually it's on the available on the IEMA website. They have a special page just for public assistance forms. I mentioned it earlier. That's where you can find their public assistance handbook, and basically every other form that you could possibly want. All the way toward the bottom, it's form PA 103, and that's the quarterly progress report.
Perfect. Question related to that progress reporting. So if you had one-time expenditures, our question here is, do you have to submit quarterly reports for reimbursement of equipment and supplies like sanitizer and PPE? These are one-time expenditures, so I'm not sure why quarterly reporting would be necessary.
Yeah, I would say, again, not speaking for IEMA, but if you consider the fact that a lot of the guidance and the forms and the whole program is geared towards natural disasters, where you're rebuilding things, a lot of these are very much labor and contract intensive. I'm speculating, subject to confirmation with IEMA, that very few of us are going to need to worry about the progress reports, especially if, the bulk of the costs have probably already been incurred. And if you stay on top of the application process, get all the forms in, you may optimistically receive reimbursement before a report would even be due.
There was a section you had covered with the eligibility component of prior findings with regards to any previous grants that you have been awarded. Does that threshold or the requirement to respond to any of those findings relate to any state grants, or are those just federal funded grants, or do you know the answer to that?
I believe this is in reference to the risk assessment form.
Yes.
That's
yes.
IEMA. They don't specify in that question of whether it's related to federal or state grants. So I would say answer it honestly, because management of any grant program can be indicative of how you manage all your grant programs.
Sure. Next question, are part-time employees eligible at the straight time that you had referenced? And so I think this goes back to if you had to hire a new employee for COVID related versus budgeted employees. So maybe if you could verify that discussion.
Sure. I believe the determining factor is whether or not the employee was budgeted, whether or not they are full or part-time. If you hired a part-time person specifically to work on COVID-19 activities and they were not budgeted, they are reimbursable at straight time. If they are a part-time employee that was budgeted, then the overtime factor would apply. So the determining factor is whether or not they were budgeted, not whether they're full or part-time.
Okay. And I think we're, the bottom line, and Tim and I have discussed this too, is that budget employees, just to reconfirm, it's only going to be their overtime cost. So it's not going to be, their regular time if they were, in training during their regular hours. It was only being incurred overtime because of that training.
Right. Another eligible cost question, activities and expenses related to protecting employees, question mark. So PPE that's used for employees, modifications to workspaces like partitions and glass panels at service counters, etc. Would those be eligible costs under the FEMA, IEMA grant?
Tanya, I'll let you chime in after I give my opinion. Because under the personal protective equipment section, it doesn't really say it has to be the general public. I would recommend including those costs. As for redoing workspaces and things like that, specifically for employees, I would check with IEMA on that. I think it's possible, and if you're being optimistic, it could be a good idea. But again, they're not allowing equipment purchases for having employees work at home. So I don't know if there's a line being drawn there, or if they're kind of going to group those as the same purpose. Tanya, I don't know what you're talking
about. No, I would 100% agree with you on that, Tim. There's that fine line, and I think reaching out to them and just asking and questioning it before you go spending the dollars on it, if you think you're not going to be reimbursed for that. Granted, you want to make your employees safe, but if you're looking to get reimbursed for it, I would definitely question it ahead of time. But I would completely agree with Tim on that.
And Tim, back to the protective gear, would masks purchased and handed out directly to residents be a qualifying expense or an eligible expense in your opinion?
In my opinion, yes.
Yes. Great.
I think there's even somewhere noted in somewhere in some of those expenses too, is even handing out water. So handing out masks, I think, would be, you know, a expensible item too.
Yep, I think that's probably one of the most clear-cut eligible costs that that you could have.
Yeah.
Question again on cost related. Can you submit overtime for employees working for members who were quarantined?
If I understand the question, probably. Again, if you're addressing, if it's directly related to the public health and mitigating the effects of the pandemic, and it's overtime for a budgeted employee, my guess is that that would be eligible.
Some similar payroll related questions to continue. How about wages that were paid for an emergency FMLA leave?
Yeah, I don't think so.
Yeah.
Tim, I don't think that's part of, but I'll let you confirm.
I agree with you, Tanya. I don't think that's eligible.
I also agree that I just wanted to get the panel's feedback on that one. Wages paid for employees who took the CARES medical leave due to a positive COVID-19 test, whether it's their family member. I think that follows the same, especially if there's CARES Act reimbursement being received. We can't double dip on those wages.
Right.
I would agree.
A clarification on the PPE costs. Are you reimbursed based on the actual equipment used, or do you get reimbursed based on your purchase that is based on anticipated need? For example, we purchased 1,000 masks based on our anticipated need, but may only use 500. Do I get reimbursed for the 500 and not the total, or basically what was in theory spent on the invoice?
Well, I believe there's a bit of an honor system. You know, you have support that you purchase 1,000. They're not going to necessarily audit whether you handed them all out. You know, there's an ethical question there whether, you know, you can. Yeah, I think it's a complicated answer. If you don't have the ability to return them, if you only purchase them because of the COVID-19 response, you know, I think that'd be a great question. Safely, I can say easily the 500 that you've passed out would be eligible. The remainder, I'd say, is gray area. I don't have any direct experience with that. Tanya, I don't know what your thoughts are.
I would agree with you on that, John. I think if you have the support to show at any point that you're gonna, you have that to back it up. But I don't think there's a definite answer on that, like you said.
Yeah, I would agree. Couple more payroll related questions here. So regarding payroll reimbursement, would it cover overtime in the police department or fire department that was required because of staff shortages due to actual staff illness, COVID, and required quarantine?
That is a fantastic question. I'm going to add that to the list of questions I'm going to turn over to Aima. Tanya, I don't know.
And I believe the answer is yes. It's the overtime, but they have to have the backup. So document the reason why and who they were covering in that and the times. The documentation can be key with that.
Agreed. Real quick question, is there a minimum that you need in order to submit for FEMA reimbursement? Is there a minimum application dollar amount that's even considered as part of this process?
I don't believe so. Tanya, correct me if I'm wrong, but I don't believe so. Just do a cost benefit analysis. There's a few hours that goes into managing this process. So if you've got $1,000 worth of costs, it may not be worth your time to go through it. So, you know, that you should use your judgment for. But I don't believe there's an authoritative minimum.
I haven't seen any minimum either. So
another It's a related question. They have an entity who requires testing for entry-level firefighters that have had to be rescheduled, and they are now going to be completing that testing remotely because they are in need of hiring a new firefighter. There's an additional cost of $15 per person to do this remote testing. Could they submit for that?
Offhand, I don't believe that would be eligible. It's more of an inconvenience factor as opposed to directly related to protecting the public health.
I would agree.
And I think it goes back to that employee equipment part too, and they're not gonna, that's ineligible.
Right.
Many of our park districts are paying a reimbursement method of unemployment. Is the cost of unemployment a qualified expense?
Great question. Tanya?
I don't know the answer to that. That one I do not know.
That one I have not heard any direct feedback on either. But yeah, I think, Tim, if we can add that one, obviously I know some of our park district group would be quite interested in the response on that question, just based on the number of questions I know I'm receiving from that group related to the unemployment piece.
Agreed.
Yeah, and that might be part of that CARES Act too.
Yeah. And probably other government entities who maybe haven't yet gone through, a furlough process, but maybe looking towards that in the future, unfortunately. So potentially to have an answer on that unemployment would be probably helpful, and we can certainly provide that response once we're able to get in touch with IEMA through our follow-up communication after this presentation.
For sure.
Next question. If you wait to submit, are your chances lessened to receive funds? So is it a first come, first serve kind of concept?
I think it's safe for any grant funding opportunity to assume that's the case. I don't know the maximum amount allocated. Like, I don't know what FEMA's budget is overall.
Right.
But I think, especially for a lot of smaller organizations, the big guys are going to be all over this, and they're going to be asking for a lot of money. So if you have, a smallish amount of funding that you're requesting, I'd say sooner rather than later is best.
Next question, and I'm just going to read it verbatim. To clarify, Tim, you should only complete one project application once the COVID-19 event has ended, is winding down, or the ending date on the declaration has been reached?
That's a great question. The suggestion is whenever possible, only submit one project application. I think as things progress and have progressed for the last couple of months, we've got a picture forming of what all is involved and what's being asked of us to do and what costs we're incurring. So I don't think the expectation is that everyone's going to want to wait until, governor says, okay, we're all back to normal. But if you're in a position where you feel like you've incurred 80 to 90% of your costs, then you can start planning on getting us submitted. Another important point is you can submit a project application for projects in process. So if you are at a point where you kind of know what you're in for, and you're only halfway through your process, so you've only incurred half of your costs. If you have a reasonable estimate of the rest, you can go ahead and submit that application for the entire project. You'll just be expected to accumulate that documentation and support those cost estimates when they are incurred. But I don't think that anyone is going to want to wait until the end of the calendar year to start putting these applications in. And if you do submit an application, again, it's only a recommendation. You don't only put in one. If you submit an application, it's in. If you have additional costs, you can put in a second one.
Yeah, so I think we just got a question in clarifying that. So can you submit the project application and then keep adding to it? So I think you've just answered that question as well.
Yep.
I think my last question, unless people want to get any more in, I think I'm down to the last one. Are indirect costs eligible?
I haven't seen anything specific to indirect costs. I don't believe, and this should be an overall, you know, if you have any experience with FEMA grants, the same thing should apply this one. Really, the only thing that I've seen that comes close to an indirect cost is the benefit calculation if you're doing force account labor. So Tanya, unless you're aware of something else, I don't believe any indirect costs are eligible.
No, I'll agree with you. I believe the some of the taxing is eligible, like you were saying, for the forced account labor, but that would be the only indirect I would include on that.
Okay, I think that has cleared our queue of questions, guys. So I'm going to turn it back over to you for closing comments at this point.
All right, thank you, Jamie, and thank you all for attending today. Again, I realize that, you know, this whole thing is a work in progress. So keep tabs on information coming directly from IEMA and FEMA. Be you know, careful with information coming from other sources. You know, again, even from us, I say, you know, some of these things are our opinion, so they're not authoritative. We hope that this has served as a guide for you to keep the process going. But be sure to be in touch with your, you know, with IEMA and with FEMA as necessary. We will, I'm going to flesh out this slide that's out with a few extra links, and then we'll share the slide deck with you all so you can have it for reference. Tanya, any closing thoughts?
I think just the biggest thing I've learned through all of this is just document. If you haven't started documenting, make sure you start documenting now and everything and anything to back up your costs.
Yes, totally agree. And with that, we'll go ahead and conclude the presentation. Thanks again for spending part of your afternoon with us today.
Yes, thank you, everyone.